Good morning. Welcome to Healthcast. I'm Fred Liss, and I am a physician and the president of HERT. And today we're looking forward to having a conversation with Bruce Stewart from Shoreline Orthopaedics. And without further ado, here's Bruce. Good morning, Bruce. We have the great pleasure this morning for our HERT podcast to have a guest, Bruce Stewart, who is one of the principal physicians, the lead physician at Shoreline Orthopaedics in Holland, Michigan. And we're really been looking forward to having a little conversation about some sports medicine issues and also just, what it's like out in Holland, Michigan, because I'll be honest with you, I'm an East Coaster. So I wanted to start off and just let Bruce introduce himself, but I have some questions about where you are and maybe tell us about your area.
Sure. So thanks, Fred. Bruce Stewart here in Holland, Michigan at Shoreline Orthopaedics. Holland is about 2.5 hours north of Chicago, right on the lake shore, going up Lake Michigan. Shoreline Orthopaedics is a group of 10 physicians, and most of us are orthopedic surgeons. We have a physiatrist as well. She does interventional physiatry, but she's also sports medicine fellowship trained. And so she's part of our collaborative team. We work closely with Holland Hospital and have a partnership where we've started a sports medicine collaborative where they have 2 primary care physicians who did fellowship training in sports medicine as well. So they're non-operative sports medicine specialists. And then on our end, we've got me, who's a sports medicine orthopedic surgeon, so fellowship training in sports medicine, and take care of both operative and non-operative things that I see. And then we have Teresa Hooperkar, who is a physiatrist who did a sports medicine fellowship as well. And so the 4 of us really work closely together as part of this collaborative program between Shoreline Orthopaedics and Holland Hospital. And that's worked out really well because not only do we have the 4 of us, but then we also have all my partners here at Shoreline Orthopaedics, because sports medicine is sort of a kind of catch-all. There's, it means we take care of athletes or injuries that happen to an athletic population. And so it doesn't necessarily mean it's just your knee or just your shoulder or wrist. It can be anything from your fingertips to your toes and up to your head and neck. And so we need to be able to take care of all of those things. And so it really takes a team approach. And so my partners are great. I've got hand and wrist specialists and foot and ankle specialists and everything in between, so that regardless of what happens, we can take care of you from a musculoskeletal standpoint. But then one of the unique things about this collaborative with Holland Hospital and this program we put together in the community is we've gone out and found dentists and ENT doctors and ophthalmologists and other people to join our collaborative so that the athletic trainers are a part of this, have direct access to all specialties, not just musculoskeletal, but all specialties that can end up getting injured during a football game or hockey game or basketball or whatever the incident is, because the athletic trainers are terrific and they're really well trained and they can take care of most injuries and temporize them, but they're really, really good with musculoskeletal stuff, but probably a little bit more out of their comfort zone if a tooth gets knocked out or somebody's got, abdominal pain after an injury or something else, or they're having trouble breathing because they got kicked in the throat or something like that. So to have really a lot of people kind of coming around this program who have direct access, the athletic trainers have direct access to them, it really gives the athletic trainers a lot of comfort to know that they've got backup that they need. It gives parents and other people who have kids out there competing comfort to know that, hey, we've got everybody engaged in this program and supporting the student athletes who are out there, regardless of what may come up. And then the connection to Holland Hospital, that we did a case study here a year ago when we had an athlete who I was on the sidelines covering a football game, and he went down, just a collision with another player, and he had a very clearly broken leg. So it was a tibia and fibula fracture, and it was immediately obvious on the field. And so the athletic trainer came out, the paramedics came out, I came out onto the field. We got the athlete stabilized, and then I just called, and we were only a few miles away from Holland Hospital. I called the emergency room directly and said, hey, I've got this athlete, this football player here who's got a broken leg. Just want to let you know he's going to be coming in. He got right into the emergency room. I had this seamless transition then through the emergency room, getting the x-rays, and then we took him up to the operating room, and then he was able to rehab after that. And it was just a really good example of what we're trying to do to really be able to provide kind of concierge level care for athletes. And that's what we're doing with this program, to really have everybody involved, every different facet within the community that needs to be able to be involved in the care of athletes we have. And so that's a program that we continue to develop. We've brought in behavioral health specialists to be part of this too, because if you're an athlete and you have an ACL injury or some other season-ending injury, it's not just the physical part that's so difficult, but it's really also just so emotionally devastating for a lot of athletes and people in general, but for a lot of athletes, because it takes you away from what you love doing. It takes you away from your friend group. So everybody else is still out there being able to play and participate and doing all the fun stuff that they love to do. And that's taken away from you. And so to go through a period of anger and grief and despair and frustration, all those things are all normal feelings. But sometimes it can be overwhelming. And so we want to make sure that the athletic trainers are given the skill set to be able to help those athletes and identify people who are struggling with some of that stuff, and then have resources available for people to be able to talk to and get some extra help and encouragement if they need it. And so we're really trying to build a very holistic program that takes care of the physical and the emotional and mental needs of the athletes that we are taking care of in this community that we serve.
That's awesome. What I'm hearing you say, and I really love this because I'm a believer in comprehensive care. I mean, our athletes, and there are a lot of athletic programs. Athletics are so huge in the United States. They deserve to be treated in this fashion, because we can't first of all, we can't be on the sideline for every single injury. And we need to have a system in place. And it sounds like you guys are really working on that. I'm curious to know, what's it like? The real purpose of HURT, our access program, is to make sure that we can deliver access to healthcare and to the needed services immediately from the time of injury, which is what you're describing here. So I'm curious to know, of all the places that you service, are there places where you can't have a trainer, where you need to have connection from the field to your system? And how does that work for your practice?
So, that's why we've partnered with HURT, Fred, because we recognize that, we're there Friday nights. We're there for the Hope College football games on the sidelines on Saturdays. And we're there for a lot of other events, but we can't be everywhere every second. There's a lot of stuff that happens outside of official school-sanctioned sports. And there's stuff that happens in the summer or after hours. Or there are times where it's a travel league, or it's a tournament, or it's just people out there playing pickup basketball in their driveway, or whatever it is. And so we recognize that we've built a really good program to take care of the athletes and the things that happen in official sanctioned events. But there's a lot of stuff that's happening in a lot of the travel sports, and travel sports have become so huge, right? So, if you want to be a competitive soccer player or basketball player, you really need to be doing, for most, unless you're just a phenomenal athlete who just has gifts that are beyond what most people have, to be able to do that travel basketball and travel soccer and all the other things that frequently don't have an athletic trainer there. And so how do we take care of the people who get injured in those settings? How do we take care of people who get injured in their backyard? And how do people know what the seriousness of the injury is? And so, for years, ever since I've been in practice, I get calls from friends and from family and friends of friends and friends of friends of friends, and people who are my wife's friends or people I don't even know, but somehow have my number. And so, and I'm always happy to do that and happy to give advice and say, what? Okay, well, send me a picture. Okay, well, where does it hurt? Can you walk on it? And all those sorts of questions that we would do to kind of triage and decide, is this an emergency? Does it need to be seen right now? Do you need to go to the emergency room, or can you wait until the next day when we're here in the office and we'll get you right in and we'll take care of you. And so what HURT does, and it's so great about this partnership that we have with HURT, is that they do that. They give everybody essentially this kind of premier access, like my friends and family have had for years. And so everybody then almost becomes like friends and family because they have immediate access to expert care, and they can say, yeah, this is where it hurts, and they send a picture, to the athletic trainer now who is staffing this and who's watching and who's communicating with them, and they're talking to them and they're saying, okay, well, yeah, it hurts when I press here, or it doesn't hurt when I press here, or I can walk, or it's not swollen, or it is swollen, or whatever the injury is. And then they get that advice that I've been offering to friends and family this whole time, of,
Right.
hey, you know what? No, your bone's sticking out of your skin. This is an emergency. You need me to go to the emergency room. But
Yeah.
90 plus percent of those aren't that. They need reassurance that, yep, go ahead and just put some ice on it, and then we'll get you right in. And the great thing with Hurt is then we have that partnership, and they'll contact us the next day and say, hey, John Smith contacted us last night. Looks like it's an Achilles tendon rupture. We told him to ice it, and we'll get you in first thing tomorrow. And so we have that now access, and it pairs nicely with our orthopedic urgent care and our orthopedic walk-in clinic. So people then can get directly in, and they have the comfort that they can go to bed at night and know that it's okay. There's a plan. They're going to be seen tomorrow. And so it really gives everybody in this community, and not just official athletes, not just your high school and college and professional athletes, but just any weekend warriors or anybody else out there, that peace of mind to know what's going on and have a plan.
Yeah. So it's interesting. So the Hurt platform was developed by my partners, Brett Miller and Jim Ostis. But Brett is an orthopedic surgeon. He's our CEO. And the reason why we did this is exactly what you're describing, because you talked about the emotional stress that it comes with injuries. I'm a hand and upper extremity surgeon. I'm very well versed in that trauma of having to deal with the injury. But one of the things that's often overlooked is the trauma that our parents and our loved ones feel when a loved one is injured. And a lot of times having that reassurance and that access immediately to know that everything's okay, that, hey, I don't need to go to the emergency room, or, hey, I can get to Holland, to Shoreline Orthopaedics urgent care today, and we can triage them and get them to that point, the best and highest use of their time and the reassurance that they all need. And that's really something that kind of has been absent and has been working in the opposite direction in healthcare. We love working with practices like yours who have that conscientious feeling about wanting to make sure that you service patients, because I don't think there are many doctors out there who want to play hard to get, but I think patients in general feel as though the health system has pushed them away from their doctors. And, I experienced the same thing in my personal life. I can't tell you how many times my wife would call and say, Susie just called me, her husband hurt himself. Can you get him into the office? Or on the weekend, somebody stops by. Well, this is Hurt is an access program that allows you to really service your patients in the ways that you're describing. And I love that. The other thing that's really interesting that I wanted to drill down on a little bit with you is Hurt really started out, it was originally called, Sideline. We had the intention of this being a sports medicine program, and it's grown into a comprehensive access platform. But, it's really ideal for situations where you don't have a trainer in a place, or, children get hurt, or high-level athletes get hurt, and they just want to know, what do we do? Because one of the things we've discovered, Bruce, is that close to 90% or more of musculoskeletal injuries that show up in an emergency room don't need the emergency room. In other words, they end up being discharged and being told to go see the orthopedic surgeon. So what we're trying to do is give access to those folks who need to have your special services. We don't think anybody is more suited to take care of MSK injuries than guys like you and your practice. So we love that. And I think the sports medicine thing is something I want to hear a little bit more about you. How do you see utilizing the platform to help you to grow your sports medicine program? I mean, you guys really have a comprehensive plan. What can you do, and how can Hurt help you to grow that so that your access is broader in the area of the peninsula of, the Upper Peninsula, or where you guys live and breathe? So can you use it as a tool? Is it a way for you to expand your services to get access?
Yeah, so what we're doing with Hurt right now is really using it as a tool to be able to allow athletes from all over to be able to come and see us. But it's not just athletes, too. I mean, people just can be walking down the stairs in their house and twist their ankle and use this. You don't have to be an athlete to use Hurt. But for the athletic and for the sports medicine program in general, it's really just another tool to expand access to allow people to come directly to us. And, Fred, you brought up that point about a lot of people who have injuries. 90% of them don't need to go to an emergency room. And so what this really allows us to do is save people a lot of time and a lot of money. Emergency room visits are expensive, and frequently there's long waits and everything else. And then you go to the emergency room, they take x-rays or do whatever, and then you get told to see us anyway. And so this really cuts out that extra step and provides direct access to the people who are going to be providing the definitive care. And this pairs nicely with what we're doing with our orthopedic walk-in clinic and orthopedic urgent care. We're really trying to streamline care for people to make it easy and more affordable too. And so you get the right care at the right time, at the right place. You're kind of skipping out that more expensive time and intensive step of going to the emergency room. And emergency rooms are really important. I mean, we have to have them because there are things that really require emergency room visits, but most things do not. And so
Right.
for us to be able to say, hey, let's evaluate this, let's see if it requires an emergency room visit or not. And in most cases, it doesn't. Let's get you right in and we'll take care of you. In terms of specific, I'm sorry, go on.
I was going to say, one of the things that I love about your practice and many of the practices that we work with, because with our company, we're not just interested in having any old practice. We really like to work with groups like yours that engage and are interested in really giving great service to patients. So, for example, I know you guys have an urgent care, and what we would do on a weekend, let's say a Friday night injury occurs, and we get they activated the network, and we talk to them, and we realize they don't really need to be seen tonight, but we'd like them to have an X-ray before Monday. We will send them to your urgent care the next morning, and then that's an access point to your practice, and then you can in turn get them to the subspecialist that they need, rather than going to an ER, getting an X-ray, waiting for 6 hours, and spending $3,000 of healthcare spend and walking away not really knowing a whole lot more because you didn't see the specialist. Folks can, on behalf of Shoreline, we can talk to them and say, look, we have a hand and wrist specialist for you. You can go to the urgent care. We think you need an X-ray, and you'll probably be seen on Monday morning, and we think that's good. But if you go to the urgent care tomorrow, we can temporize. And so I really think that folks like your practice who really embrace that approach and have many immediate access points, walk-ins, and urgent care are the perfect partners for us. We love working with you because of that. And I really, what I'd like to talk a little bit more about with you or hear your thoughts on, I know that there's a broad area where you live. I don't know the peninsula very well, but I have looked at the map. I've never been out where you guys live. Tell me what it's like for your practice, which is pretty much right on the shore. You are Shoreline. You're right on the lake. What's your reach? What's the broadness of reach? I know you have a great relationship with Holland Hospital. I know that if we had patients that needed to go to the ER, we would send them to that hospital because that's where you guys service. So your patients who want to be cared for by Shoreline that needed an ER would go there. What about how do you reach out and get access to some of these other schools and places where kids know about Shoreline or their families do, but maybe need a little bit more access? How could that work for you in your practice to expand and get more access to additional schools, et cetera?
Sure. So, we have this collaboration, as I talked before, with Holland Hospital, and we help oversee the athletic training program. And so there, jointly, we have athletic trainers in 5 schools currently, and are going to be supporting Hope College with their program as well. But there are other schools in the area, and then schools kind of outside our immediate area too, that can benefit from Hurt, because it really is like having an athletic trainer right there in your pocket. And so we don't have to be on your sidelines. You don't have to have an athletic trainer from Shoreline Orthopaedics or from Holland Hospital. if you go to a school that has either no athletic trainer or an athletic trainer from some other institution, but you want to come see us, you know, you can come directly to us. You can go on Hurt. You can find out what the injury is and then come directly to see us. You can come to our urgent care. You can contact us directly. We have a coordinator who works, and our goal and our commitment is to get athletes in within 24 hours of the injury happening. So whether that be to one of our primary care sports medicine trained people, or if it's clearly a more subspecialized area that needs to be addressed, then we'll get you in with that person. So our commitment is to get athletes in regardless of whether it's one of the schools that we have an official contract with. So there are a number of different schools around our area who have other affiliations with other hospital systems or wherever else. And, you know, frankly, we think we do a better job. And so, you know, ultimately we would like everybody to partner with us and for everybody to be part of our program, but realize that not everybody has taken that step. And so we just want to let people know we are available, whether you have an official relationship through your school with Shoreline Orthopaedics and Holland Hospital, or you don't. It doesn't stop you from being able to come see us, and you can use the Hurt app. You can go online, get the expert advice at the time of injury from the athletic trainers on Hurt, and then get referred to come and see us. And you don't have to go through your primary care physician. You don't have to go through the athletic trainer at your school and be sent to the person that they're going to tell you have to go see just because that's where they have a financial relationship, or they have some sort of you know, they're being told that that's where they have to send people. So you have choice, you know, you have freedom, and you can go to wherever you think wherever you think you're going to get the best care and the best treatment. And our commitment is that place is going to be Shoreline Orthopaedics, because this is what we do. And, you know, we pride ourselves, and our commitment and our whole reason for being is to take care of people and provide this kind of comprehensive care.
I love that you said choice. Choice is an incredibly important word in healthcare. And as a healthcare advocate who does a lot of work on behalf of patients and orthopedic surgeons in the government and in local and federal, I can tell you that I love the message you just said. And, you know, we're a virtual sideline. I mean, we're a tool for Shoreline Orthopaedics to make themselves and make yourselves available for people to have a choice, that if they want to get access to the high quality practice that you guys provide, that they can do that immediately without having been told what to do. We believe that choosing where you go is a very powerful step in recovery. For example, I think you and I both know that when somebody comes in through the emergency room, they don't have an affiliation. It's always a little bit challenging to establish that rapport with someone. But if somebody knows that they want access to your practice and they have this tool to get into your practice, even if you're not there on the sideline, this is a great way for them to say, you know what? I heard Shoreline Orthopaedics is really superb. I want to use them. And they have the app on the phone, or they go on the desktop. They can contact us and they can get to you very rapidly. That's a tool that I think gives your practice an advantage that we want you to have and we want to facilitate. So we'd love to see many, many more folks in other schools and areas that maybe aren't contracted with you to realize, yes, parents, you have a choice. You can go to Shoreline and you can have access very rapidly just by virtually contacting us and connecting with them. So I love that. And I think, you know, that tool is good for healthcare. It's good for your practice, but it's really good for healthcare. It's good on so many levels. So I really love that you use the word choice, because I'm a very firm believer in that as a very powerful tool for high quality healthcare. So
absolutely. And I heard what you said earlier too about just the kind of the anxiety and the fear and everything else that comes with not just the injury to the athlete themselves, but if you think about athletes, you know, and what it takes to be a good athlete and successful athlete, there is so much time that goes into that. There are lessons, there are, you know, time spent out in the driveway or the backyard. As a parent, you're working with your kid. You're watching them when they're in Little League. Maybe grandparents or aunts or uncles or other people are coming. And this really becomes a big family thing. And then when that athlete is hurt, that's pretty devastating. It's not just devastating for that athlete. It's devastating for the parents who've been there spending their weekends, traveling around the state or around the area or wherever for these travel events, and for the grandparents who've been coming and supporting these kids for all these years. And then to all of a sudden have that taken away, that's a big deal. It's not just a big deal for that kid. This is a family crisis, right? And so that's why taking care of these athletes and getting that information, regardless of what the injury is, whether it's going to be like, hey, you know what, it's not as bad as you thought it was. This is great news. You're going to recover quickly here. We're going to get you on your way. Or yikes, unfortunately, this is going to be something that's going to take some time, and we need to explore this in more detail. But at least to have an idea, to get information quickly, so that you have a plan. That's kind of the first step in starting to feel like you're taking control back, because these injuries take control away, right? We all think we're in control of our lives. You're working, you're doing all this stuff, and you have these plans in place. And then suddenly, something happens and that control is kind of taken away, and you realize you don't have the control maybe you thought you did. And that's a scary place to be. It's a scary place as an athlete. It's a scary place as a parent or a family member. And so to get that quick answer and to get that early, immediate access, immediate care, it starts to give you some control back. Okay, I have a plan. Here's what we're going to do. And then here's what we're going to do. And you start to feel like, okay, I can get through this and it's going to be okay. It might not be the plan I would have chosen right away. Nobody would choose to get hurt, but at least, okay, I got a plan and it's going to be okay. And so, that's what HURT offers that for us and for the people in this community to know early on, it's going to be okay. We've got a plan.
I like to think that in a way, healing begins at the moment of injury. I think when one is left unclear and unsure about what's happening, it delays the healing process. Because the emotional healing that occurs when you know that you're going to be okay, just hearing it and sometimes I'll tell you, our navigators, we have doctors, we have nurse practitioners, and we have ATCs that are really skilled at communicating with injured folks and their parents sometimes. But a lot of times I'll be observing a case discussion and I'll realize that there's a lot of anxiety going on here. And that as a doctor, sometimes people come in and it's like, yeah, I get it. We're fine. Okay. And then there are others who really are not certain. And I'll come in and pick up the phone and have a direct conversation with someone and say, this is Dr. Liss. I want you to know you're going to be okay. That you're going to get to Shoreline and the sports medicine doctor is going to see you tomorrow. You're going to be fine. That is a huge advantage for the starting of healing for people. And I really love that about, your philosophy about your practice, because not every doctor does that and not every practice does that. And I think that's a huge advantage that you guys bring to the table. And we'd really like to see lots of folks on the entire peninsula understand that access is just in their pocket. They can have an app on the phone. They can immediately get to you, and that they will begin the healing right away. And that's one of the things that we really love about our platform. It brings patient and doctor closer together again. I know that a lot of us talk about that doctor-patient relationship and how it's been affected by all the stakeholders in the middle. It's the truth, though. Patients need access to the doctor, and there's nobody better to take care of a musculoskeletal injury than guys like you. And that's really, really wonderful. Tell me one thing I wanted to ask you that I've been meaning to ask you. Tell me a little bit about being on the shoreline, being right up against the lake. Does that present challenges for your practice? Is it hard because there's nobody to get out in the lake? What's it like to have a practice that's sort of got a border on one side? How does that challenge your practice, and how does the HURT app maybe potentially help you?
Sure. So, you've nailed it. Like, we're landlocked. We can't grow west. So all our growth has to happen north, south, or east. And so we recognize that. And that's, we're in Ottawa County, which is the fastest growing county in the state of Michigan. And so we're between Grand Rapids and Holland and Muskegon. these are fast growing communities. It's a great quality of life out here. There's a good economy. There's lots of diverse industry and everything else. And so this is a really attractive place to live. We are expanding our locations. We're growing as a practice because of the growth that's happening in this area. So we currently have our office in Holland, but we've opened an office in Hudsonville, which is kind of halfway between here and Grand Rapids. We recognize that's a really, really fast growing community as well. And so we wanted to be able to be convenient for patients regardless of where they live. They don't have to drive out to the lakeshore. They can be seen closer to their home. That works really well for student athletes and just anybody who are participating in any sort of activity where they might end up getting injured. And again, you don't have to be an athlete.
Is Hudsonville, I believe, if I'm not mistaken, that's a location where you do have an urgent care?
We do have an urgent care in Hudsonville as well. And we are opening a building in Zeeland. So it'll be Holland is right on the lakeshore, and then Zeeland is about 5 miles from here. And then Hudsonville is another 5 or 10 miles. So over the course of 20 miles, we're going to have a place that's a short drive from you, regardless of where you are. And so we're going to have walk-in access and urgent care access at all 3 facilities. And so it really allows people that they're never going to be far from Shoreline Orthopaedics. You can come in directly and get seen right away. And then, HURT can direct you to the spot that's going to be most convenient for you. So, and let you know, okay, well, hey, here's what you can expect. We'll get you seen. Yeah, it sounds like you're over in Jenison. Okay, well, why don't you go see the Hudsonville location? That's going to be really convenient for you. Or you're out on the lakeshore. Why don't you go to their office in Holland? HURT will help direct people too. And it's just good to have choice. It's good to have option. And it's good to have convenience. That's why we've started making sure we have Saturday hours so that people don't have to wait through something that happens on a Friday night. They don't have to wait until Monday. We can see you on Saturday. We just really want to be accessible to people.
Yeah, I love first of all, I love the multiple locations. I think that really makes it helpful. And one of the things about the HURT platform that we're really good at is we have an amazing platform that tells us we know where the patient is when they get hurt. We know where they live, and we know where all of your facilities are. And we can match them very rapidly, not only to your urgent care or your walk-in or to the office that they choose, but also to Holland Hospital when they need to get to the hospital. So we have a unique way of doing that. And I think your multiple outposts strategy is really fantastic. And it just adds and meshes really nicely with the access program. So I love that too. So yeah, listen, it's really been great talking to you. I think, we have a great partnership. We want to grow it. I love the idea that we're working together to try to create more access for the athletic programs in your region, because it's a broad region. You have a lot of areas that should have access to your practice, and we want to work with you to continue to make that happen. And we just love your philosophy. We think that what you're doing and the way you approach your orthopedic surgery practice is not just about fixing bones. You guys are comprehensive, and that's really, it's unique amongst the top orthopedic practices. Even though you only have 10 doctors, you guys practice like a very large practice, which we think is really a great asset.
Well, thanks, Fred. It's been great talking to you, and I appreciate this opportunity. Something else I wanted to just touch on a little bit is, it's not just about it. I know this program started as Sideline, and then it became HURT, and it started as an athlete-focused thing. But what we found is that our urgent care isn't just athletes. A lot of times it's people who are 50, 60, 70 who have their knee started hurting, and so they want to get seen too. And so, or it's a worker, it's somebody who gets hurt at their workplace or who strains something or does whatever. This can work for them too. You don't have to be an athlete. You can be what some people call industrial athletes. If it's factory work or something that happens, at the job, this works for you too. You can get that expert care and that quick consult really right away and get directed to the person who you need to see right away. So while it started as an athlete focused program, and we still use it very much for that, it really can be for anybody. And that's the beauty of it. It doesn't have to be just pigeonholed for this niche. It's and we welcome people at work or from other locations to use it as well.
Well, as you probably know, we just rolled out a whole workman's compensation module that really facilitates the ability for nurse managers and injured workers to be able to connect with us directly, and then get to the doctors in your practice who manage the workman's comp things as well. And we also, you talk about joint pain. I always joke with when we're talking with new potential clients. It's always the total joint surgeons who say, hey, this thing's not for me. Then I'm not going to get any business out of this. Well, the truth of the matter is a lot of people kick the tires about putting their toe in the water about whether they should get their knee checked out. And we have a tool called Joint Score, which is being vetted right now by a research group out of North Carolina that really gives a tool online. It's present online now, where an individual who might have hip or knee pain can do an assessment of themselves and get an idea of where they stand with what can be done, and if they need to see a non-operative surgeon or a non-operative specialist or a surgeon. And so we really are, I like that you brought that up. We really are a platform that answers all aspects of musculoskeletal care. It's not just athletes. It's definitely the total joints. We do spine evaluations. We have every different area, and the workman's comp thing is huge. We also work hard to get to the direct to employer contracting in everybody's neighborhood, so that we can bring more patients to your practice through access to self-insured programs. So yeah, that's a really important thing that a lot of times I kid because I'm a hand surgeon, and as you know, I was from a big practice in Philadelphia, and the total joint guys always say, what can you do for me? Well, we do service them quite well as well.
Absolutely.
Yeah.
And also, I mean, we see people just in our urgent care walk in, you think those are going to be things that just happened or injuries. I'd say probably more than half of them are just knee pain that's been around for a long time.
Right,
so
right.
Again, it doesn't have to be a totally urgent thing. And what I love about HURT is that, just because you started with one thing doesn't mean you're done. And that's all this is. HURT is growing. Shoreline Orthopaedics is growing and expanding our market. We're hiring new physicians. We have 4 new physicians who are going to be starting here within the next 10 months. So we're a growing practice, and we're expanding our subspecialties and our reach. HURT also is a growing service and expanding its reach to not just athletes, but also, as you mentioned, the work comp and the joint pain patients who, just kind of chronic pain. And so we're kind of growing together. And so we're really going to be just able to have more and more capabilities. And so I couldn't be more excited about this partnership.
Well, I appreciate your saying that, because one of the things that we pride ourselves in, and this company is run by orthopedic surgeons, is that we adapt and we pivot and we listen, because we understand how orthopedic practice is. We know the intricacies and the difficulties. We know what patients feel like. And so when a practice partner like you says to us, hey, I was thinking about this, let's talk about this particular problem, we're on it. We love that kind of collaborative discussion. And you guys make us better, because forward-thinking groups like yours are really what drive the practice of orthopedics in this country. So we're really grateful to have you as a client, and really enjoying working with you quite a bit.
It's been a great relationship, and we look forward to continuing this and continue to expand and grow and develop as as the market dictates, and as new things become available, new capabilities become available. We want to just keep providing better and better and better care. We're never done. We're never satisfied. We always want to be better. And I know that's how HURT feels. That's how Shoreline Orthopaedics feels. And it's always, okay, that worked. Okay, now what? Now what? How do we get better? How do we move on? And
beautiful.
And so we're like-minded, and that's terrific.
Well, that's a great way to wrap this convo. I really agree with that philosophy, and appreciate you so much. So thanks for taking the time to join us today, and look forward to continuing to work together with you.
Absolutely. Thanks, Fred. It's been a pleasure. Really enjoyed the relationship, enjoyed the conversation, and enjoy continuing to work together here in the months and years ahead.
Cool. All right. Take care, Bruce.
Thank you. You as well. Bye-bye.